For Blacktown.
Thank you, Speaker. Last week I started to speak on the improvements at Blacktown Hospital over the past 3 years. I'd like to thank all the staff for their hard and dedicated work in putting their hearts and soul into doing the best they can to help the patients and their families. Shane Whittaloka, the Chief Executive of Blacktown and Mount Druitt Hospital, leads the team and is very passionate in addressing the needs of the community and patients. We both acknowledge that we won't always get everything right, but what I really appreciate is her openness and willingness to critique the actions of the hospital and see if there are learnings to move forward on. I also like to mention that since Amanda Larkin has become the Chief Executive Officer of Western Sydney Local Health District, it's like a breath of fresh air as Amanda and her executive team listen and work with staff, patients and their families and communities to see how one of the largest populated health districts can deliver the needs for our area. Last week in this house I spoke about the T2 ED emergency treatment times. I reiterate, in March 2011, when the Coalition won office, 85% of the patients triaged as T2 emergency patients were seen on time. By the time the Liberal National Coalition lost office in March 2023, these rates had fallen down to 16% and as low as 10% in the preceding 6 months. We should stop and think about that for a moment. 1 in 10 people were triaged as an emergency patient that must have been seen by a doctor within 10 minutes were not actually seen on time. 9 out of 10 didn't get to see the doctor. So despite spending $700 million on bricks and mortar, creating the world's smallest waiting room, winning 14 architectural awards, we saw the Liberal years of a crisis in maternity, chaos in emergency, and the lack of staffing to address the population growth, as well as suppressed wages for our health and allied health workers. Since the election of the Minns Labor government, Minister Ryan Park issued instructions to our executive to work with the community representatives, staff and patients to deliver improved programs. What has been delivered in the last 3 years is an equivalent full-time workforce increase by 59 medical staff and 96 nurses. That's 155 extra equivalent full-time staffing. $120 million allocated for 60 new beds for Blacktown and Mount Druitt Hospital, 30 each, with 30 in Blacktown being delivered by the end of this year. The $910 million brand new Rouse Hill Hospital will take pressure off Blacktown. New ED ward of 8 beds for aged care home patients who are presented at ED. Hospital and Home program introduced, new virtual hospital unit established at Blacktown Hospital, a new breast screening clinic opened in 2025. Yes, the last one closed under the previous government and screening rates fell. Removed the wages cap and established the Industrial Relations Commission with the recent decision of awarding nurses with one of the highest wage increases in decades. The state government payroll tax subsidy for GPs who bulk bill more than 80% of their patients. Patients waiting longer than a recommended elective surgery was 412 patients in March 2023, from a high of 509 back in September of 2022 to a 0 in December 25. The last quarter that's available under a Labor government went from 509 patients to 0. Expanded role for pharmacists and healthcare services. The federal government's also provided 2 urgent care clinics in Rooty Hill and Quakers Hill and a brand new mental health clinic, Medicare mental health clinic. There are many challenges in our local area, and this has just been part of the Minns government's ability to actually make a substantial difference. We have seen the rates fall down as low as 10%, as I said before, in emergency, and we have now moved to 40% being seen on time. Mr. Speaker, as much as these numbers aren't great, there's still a lot more work to be done, but because of these fundamental changes in how health is treated in the Blacktown area, we are now finally starting to see changes and improvements in the area and bringing everyone on board. forward. So shame on the Liberal coalition, and this is why we can't allow a Liberal, national, one nation coalition. A Conservative government would be just absolutely tragedy for the people of Blacktown.